Hello and welcome to the clinic today. My name's Aisha and I'm a skincare expert. I'm here to help you with your skin. What brought you to the clinic today?
I'm having issues with a lot of blackheads. I'm worried about scarring and some dry skin with the weather changes. I'm wanting to understand a bit better how I can minimize my blackheads, make sure that my skin is clean and I'm not getting any more blockages and more acne coming throughout the summer.
And on a scale of 1 to 5, with 5 being the worst breakouts you've ever had, how bad is your skin for you right now?
I would say it's a 2. It has been a 5 before with cystic acne, but I'm quite concerned it's going to come back again when I'm using certain products. I get quite concerned with that.
And did you take medication or did you use any topical medicines in the past to help your acne?
Yes, so I took Roaccutane, and when I've used topical, I've had harsh reactions. It was too harsh on my skin.
So was that an ingredient like a vitamin A, like Retinoid or Retinova? Do you know if the drug was prescribed to you by a doctor? And did you get a lot of peeling from it? Is that why you're saying it's too harsh?
Yes, so it was from a doctor and I got a lot of peeling and reactions, but vitamin A is fine on my skin.
And do you use vitamin A right now?
No.
Okay, so and have you ever used it in the past?
Yes.
You have. And what did you use?
Drunk Elephant, I think.
And what skincare are you using right now?
Normal drugstore products for like moisturizer. I use an everyday kind of sunscreen, and for blackheads, I don't want to exfoliate really roughly. I use a brand called Pores.
Paula's Choice, yes. And is that the benzoyl peroxide product that you have? Okay. And how frequently would you use benzoyl peroxide?
Every morning and night.
Okay. And with your cleanser, is that also exfoliating?
No.
So you have a gentle cleanser and then you have benzoyl peroxide and some kind of moisturizer in the day.
Yes.
And then at nighttime you repeat your cleanse, use your benzoyl peroxide, but you don't have any other product at night. Is it like a serum or that's
Not that
it?
I can think of, unless it's like a normal acid that I'd use maybe once a week, which is the Ordinary acid.
And is that a peeling mask that you're using once a week from the Ordinary?
No, just like putting it on.
Okay, so like more like a toner.
Yes.
But it's a bit more active.
It's a toner.
Okay.
Yes.
So it might be a glycolic acid toner, for
Yes.
example. Yeah, because they're like more commonly found when you go into a shop or if you're buying skincare online. Glycolic acid is a very popular choice, salicylic acid as well. And when you cleanse your skin, how tight does your face feel immediately after?
Quite tight, and I'm not doing it in the shower, I'm just doing it at the basin, and it is very tight after.
So would you have to use a moisturizer every day?
Have to.
Okay. And would you consider your skin to be dry or oily?
It's a T-zone oily.
Okay, so you feel dry on your cheeks and then oily in your T-zone.
Yes.
Okay. And around the lower face, do you ever get pimples that are red and hard but don't have much pus coming out of them? Anywhere from here or on your neck?
No, I don't seem to get like pimples. It's very big and under the skin, or a whitehead pimple.
Okay, and the ones that are under the skin, are they like a red lump that take a long time to heal?
Yes.
Okay, and do they leave a scar ever? Or is it only if you would squeeze or pick them that they would leave a scar?
I don't think they leave a scar, but they are predominantly around this area. They take weeks to go away.
Have you ever considered, in terms of your underlying wellness, have you ever looked into whether you could have polycystic ovary syndrome? Was that ever mentioned to you?
Yes, so I'm actually currently getting tested for that as we speak. It's just taking quite a while, but I think experience, it's definitely that.
And have they spoken to you yet about insulin and having sensitivity to insulin resistance? Is that a topic that they've discussed with you yet?
I haven't gotten
You haven't gotten that far?
yet.
Okay.
It's definitely a problem because it's not thyroid.
It's not your thyroid,
And
okay.
I've always had issues.
Yeah, with irregular periods and having pimples on the lower face.
Yes.
Because our understanding of polycystic ovary syndrome has evolved quite considerably, and it used to be thought of as a hormonal issue, but actually now we're starting to see it more as an insulin sensitivity issue. And when you are eating certain foods, you're going to be triggering that insulin response, and it has a knock-on effect in terms of overall inflammation in the body. So if you're exploring it now, that is obviously helpful, but it doesn't necessarily give you the answers as quickly as you need them, because doing the tests can be tricky. If it's, you know, a blood test, or if you have to go for a scan, it's quite hard to pick up. So what we usually do is we treat people who have the symptoms as though they are polycystic ovary, and they will follow a low glycemic index plan where they're eating foods that don't spike their blood sugar. And it seems to help them quite considerably with managing their acne, so that they don't get the random breakouts that sort of leave more painful pimples that can leave a scar. And it makes a huge difference. However, it is a process and everybody's slightly different. And you never sort of can put somebody into a box and then say, follow this plan, it's going to work for you as well as it did somebody else. But at least it's a starting point, and keeping your blood sugar at a consistent level is so, so important for everybody, not just if you have polycystic ovary syndrome. So I'm glad that you're at least getting the answers that you need. And what we're going to do today is I'm going to now do a skin analysis with you. And it's a 7-point skin analysis that will actually assess your hydration, your oiliness, the amount of UV radiation that you have, because that impacts the behavior of the skin. And for someone who's older or someone who wants to prevent aging, obviously we need to protect the DNA in the skin cell, and UV radiation will interfere with that. So we'll be looking at those things. We'll also be looking at blood flow, because blood flow impacts how your skin heals and repairs itself. And we'll be looking at your elasticity, which I can tell you you don't have a problem with, and also the overall like collagen synthesis in your skin. And we can do that using a Woods lamp. So it will help clarify if your skin is oily and if it is dehydrated. You can see it immediately under the Woods lamp, which is very simple and helpful for me, because then the next step is to customize your skin treatment. And when we know your skin type, we know your problem, we can then decide on the active ingredients and how to combine them to get you the best result, and obviously to achieve something in the room today, which is magic, you know? So I'm gonna get started now. So the next step is to do a 7-point skin analysis. I'm going to pop this Woods lamp over your head, and that will allow me to see your skin type. The first thing I can see in the forehead is that you have some visible pigmentation. It's actually coming up a little bit on the red side, and that occurs when you have irritation as well as sun. You may have seen it become more noticeable when you are outdoors for a long period and you get a bit more colour in your skin. Further down the face, you can see that there is dehydration around the eyes because the eyes are purple, and that's perfectly normal. The vast majority of people will have that dehydration around their eyes. However, it does make us realise that the rest of your face isn't dehydrated because you can't see that purple on the lower face. What you can see is that you do have oiliness in your skin. So there's actually plenty of oil in your skin. I can see these little specks of orange, fluorescent orange in your pore. They actually start all the way from the forehead, all the way down the face. And that's perfectly healthy. They are a bit more noticeable in the corners of your nose where your pores are a bit more enlarged. They aren't as large as I think you may think they are. So the lower part of the face, you can also see some scarring. And that is from where you've had pimples in the past. And they are obviously close to the jawline. And these are the pimples that you mentioned were a little bit more stubborn and took a longer time to heal and maybe even more painful when they do occur. You don't have any pimples on the neck, but that can also happen if you're a bit more stressed out. You can end up getting a pimple on your neck when your cortisol levels are a bit more elevated. In terms of your skin hydration, your hydration is normal. You do have a little bit of dehydration around the eyes, but it is normal. Your oiliness is also normal. You're not dry, and you have oil all over your face in your pores. But the reason why that's important is because if you're using active ingredients, in particular retinol, it is actually blocked by the oil in your pore. So despite using very active ingredients on occasion, you may actually find that they're not really penetrating your skin. So that's why we check for oiliness. And then the vascularity of your skin, we can actually test that. When I'm doing the cleanse, I can feel that you have good blood flow because your skin isn't cold to touch, and that you also don't have any lines. You don't have photo damage. So your lines are not going down your face or crisscrossing, which is what happens when you have a far more mature woman who's lost a lot more elasticity or collagen in her skin. You don't yet have any visible crow's feet around your eyes, and you don't have any vertical lines like frown lines either in between your eyebrows and on your forehead. So your skin is definitely a little bit more on the thicker side, which is fantastic because it does have that plumpy feel. And I know how popular it is to have really plump, juicy skin right now that's very, very glossy and nearly glass looking. And you can achieve those things, but it sometimes can be at a price. So I'm now going to perform a facial treatment on you, and we're going to customize it based on your skin type that we've recognized today. So we've just completed your 7-point skin analysis, and during the analysis, I was checking to see how much sun damage you have, how much hydration is in the skin, how much oiliness, the vascularity, which is the blood flow to the skin. I was also looking at your elasticity and your firmness, and I will now tailor your treatment based on those findings. So what we did find was that you have had some irritation and sun in the past. So you've actually got a lot of pigmentation, which is a little bit more stubborn and will be difficult to treat up along the hairline. You may notice that it's more visible when you've had a bit of sun because it will darken in the hairline. And in the rest of the face, you have got a few little red marks, which could also scar, but you're not someone who tans. So in terms of your Fitzpatrick, when you're in the sun on a sunny day like today, would you typically burn or do you go brown?
Brown.
So with your heritage, knowing that you have a little bit of Finnish and also Irish blood, you are what we call a deviated skin type, which means that you can appear to look pale if you're in winter. However, in the sun, because of your Finnish roots, your body will tan. You do produce that melanin. That pigment is very essential as well because it protects our skin cells from UV radiation. It's like nature's own natural aging ingredient. So when you are treating someone who is maybe what we call a Fitzpatrick 3 or above, they always tan when they're in the sun. We need to use certain ingredients to help manage the amount of pigment they're producing before we do more exfoliating treatments that are maybe higher strength peels. But in your case, we can treat you with a peel that is a little bit more exfoliating, but we don't need to prep you prior. So that's just one of the reasons why we look at Fitzpatrick. In terms of your skin though, with your concerns, because you mentioned that you were feeling very tight on your cheeks and you're oily, that actually occurs when the barrier is disrupted. And the barrier is a bit like a bricked wall, where if all the cells are stacked healthily on top of each other and there's no gaps, your barrier actually performs completely normally. When you start to irritate your skin, if you use over-exfoliating ingredients, combine ingredients that are too harsh, which you mentioned you'd had in the past a lot of prescribed medication for your acne, you will start to erode the barrier. And what happens then is your skin will feel tighter, and that just indicates to us that we need to use ingredients that will restore your barrier. So it actually gives you back what you've lost, which is essential for healthy skin. And the barrier also slows down water loss. So essentially with our skin, we're having properties within our skin that will slow down water loss. But what we do with using a moisturizer is we actually confuse our skin. And those properties that are there to help slow down moisture loss will no longer be produced, because it feels like in your skin that you're sitting in a bathtub of water and you're already essentially filled up. But when you take your moisturizer away, because your skin is now a bit lazy, it starts to feel really, really tight, and it feels like you may even damage your skin and premature age because you haven't got that moisturizer there. So that is a moisturizer myth, and actually at your age, you shouldn't really be reliant on a moisturizer in the same way as a postmenopausal woman would be. So I could see a lot of oil in your skin. It was actually oily from the top to the bottom. And that's, very healthy, and it's totally normal. You will need to sometimes adjust your skin routine in order to allow for ingredients to penetrate more effectively. And you're already using, a cleansing routine. You've got a toner. You've got ingredients that are meant to strip the oil out, like the ordinary toner that you're using, the glycolic acid. But it's actually not necessarily doing that. I think it may be irritating your skin in the area where your barrier is the most damaged and the most sensitive. So I would be evaluating later on the types of ingredients that you could use with your skin that will help your skin to heal. So we're going to be starting off with Purity Balance, which is a prep solution that has got some salicylic acid in it, and that's going to help to cut through the oiliness that's present in the skin. This is actually suitable to use on everybody's skin. However, when you're doing a treatment on an oily skin, you want to pay particular attention to the areas of the face which you will be using your active ingredients on. Now we're just going to use it in and around the face, and that will help to open up the pore. And this product is actually also available to use at home. And when you use it at home, it works brilliantly with your retinoid, because the pH of the skin, when you're using vitamin A, needs to be more acid. And a prep solution like this will actually help to remove some of that oiliness, as well as change the pH of the skin. So that's why it's an essential item for everybody to have when they're ready to tolerate it. The next step in the treatment is Pure Enzyme Mask. This mask is gentle enough to use even on a sensitized skin. It has got lactic acid and enzymes in it from cranberries. It's a gel consistency, so it's going to go onto the skin very nicely, and you can massage it because it has a little bit more slip than a liquid mask would have. So it has a brilliant effect. It will instantly smooth and brighten the skin, and it is another product that people can use at home themselves on a weekly basis. This would actually form part of your routine, and it is essential to do an at-home treatment on a weekly basis to ensure that you're stimulating the skin and helping it to renew itself throughout the week. And you're also helping to trigger the release of your retinol, which has to convert in the skin. And the way it does that, the way your vitamin A will convert in the skin, is by combining it with active ingredients such as L-lactic acid and enzymes. We like to use AHAs that are derived from natural sources. That's why we use L-lactic, because it's actually naturally found in the body, as well as other AHAs, which have slightly larger molecular size, and that makes them less irritating on the skin, especially with sensitized skin. It's good to check to see whether the client's skin is pinking up, because that will indicate an area in the face where they may have had some irritation in the past and their skin didn't fully recover. So these are sensitive spots in the skin where they may, if it's on the cheek, actually already feel like they have some flushing there. And if it's in another part of the face where they're more prone to getting pigmentation, then you'll also see that pinkness come up. So what we've seen under the Woods lamp is that you do have plenty of oil in your skin. However, the barrier of your skin has been disrupted, and we need to address that. We also need to address that in order to treat the pigmentation that's around your forehead. This will become more noticeable with time. The other thing that could accelerate your pigmentation would be if you, in years to come, have any sort of pregnancy or hormonal surges or changes, and that will activate the pigment in your skin so that it's more present when you're in sunlight. If you want to prevent pigmentation issues and heal your skin in those sensitive areas, there are a few key steps that you have to take. The first and most important one is the cleansing routine, because the cleansing routine gives you access to ingredients that support the barrier but don't irritate it. And that's key, because a lot of our ingredients actually will, if they have foaming agents, for example, your cleanser, like sodium lauryl sulfate, that will strip the skin of the things that are essential for having a healthy barrier. And they are a bit like the nutrition that's in your food. So if you imagine you have to have healthy fats in your diet, they're also present in your skin. You obviously need to have protein as well in your diet. That's also present in your skin. You need to have anti-inflammatories and antioxidants, and they're present in your diet and they're also present in your skin. So what we're trying to do with your routine is we're putting a complex of all these families of ingredients together in one product, and your cleanser will essentially not just be a cleanser, it will also be a mask. So cosmetics cleansers will differ to regular shop bought cleansers because they're not just about feeling nice on the skin, they're actually more of a treatment, and it is what we use when we're doing a peel, or if we're doing a facial, we're going to use the same cleanser in the room as you do at home. So lactic acid is an active ingredient that you can use on a progressive basis. So with most of our cleansers, we start at 5% lactic, and you can go right up to 10%. So in your case, I would be saying use a 5% lactic acid cleanser at home, and it's going to do so many things in one product, but it will also help to address your key concern, which is your enlarged pores and blocked pores, because living in a city environment, you're getting a lot of pollution on your skin, and you need to have ingredients that can actually work on a cellular level and they can clear out the pore, and that's what L-lactic does. So you're really able to tackle all your issues, both the sensitivity and the pigmentation and the enlarged pores and oiliness in one product. But then we can even add more to it. So we can add other corrective active ingredients which help to increase the cellular renewal rate of your skin, and these also restore the barrier. And the key one with that is using a retinoid. Retinoids are active ingredients that increase the cellular renewal rate, but people have a misconception of them because they think of them as being irritating and that you nearly have to overly accelerate the rate of renewal in order to get the benefits. So there is a form of vitamin A called tretinoin, which is a prescription version of vitamin A. We use vitamin A that you don't need a doctor's prescription for, but it's actually more effective at getting into the skin because it has a delivery mechanism and it works deep within the skin, so you don't see irritation on the surface. So you get all the corrective benefits without the irritation, and you can use it in much higher strengths than you would even be able to get from a doctor. So we start at a 2% retinoid product, which in your case, I would start with Define, and then we can go up to 4%. We have another product called Refine 4%, which would be your next level. And you could even go up to refine 8%. However, you wouldn't stay on that product long term. You would actually be able to maintain your skin and have a very healthy skin long term using that define product. So in terms of your routine, the first step is to use amazing cleanser. Do a double cleanse at night to take off your SPF. Start with a gentle cleanse and then a more exfoliating one. Also use a microfiber cloth to remove your cleanser. Then in the evening, use your retinoid on a consistent basis with no breaks. So every single night, use your retinoid, even when it's sunny outside. And during the day, combine your hydrating product with an SPF. So the types of hydrators you should be using, you shouldn't be using hyaluronic acid because it's very much overrated. It isn't very beneficial for your skin. It doesn't really hydrate your skin in a way that it would if it was reaching the mattress of your skin. So the mattress of your skin is where your hydration is. That hyaluronic acid is just sticky sort of slime that's sitting on the surface, and it's attracting all kinds of pollution and other things onto the skin. So what we're trying to do is open the skin up and allow your skin cells to be able to fall away in a natural way, just like the shifting sands of the Sahara Desert. That's your skin cells. When you go in and you put hyaluronic acid on, it's a bit like adding milk to a bowl of Rice Krispies, and you leave it there overnight and you come back down in the morning and you just see a big gloopy mess. That's what happens when you use ingredients that don't penetrate or benefit your skin in a way that they would if they were what we call chirally correct, which is recognized by the cell, but also able to be absorbed into your skin and delivered in a way that your skin is actually going to get all the nutrients and the benefits. So I would be moving away from hyaluronic acid, and I would be moving more towards ingredients that are active but not overwhelming for your skin. And if you do decide to step up a little bit more, then you could start to look at antioxidant serums and maybe using a peptide. But because of your age and because I don't see any visible lines or photo damage yet, that's completely unnecessary. You should save your money and instead do maybe a treatment once every 3 months, once every 6 months. Those steps will help you achieve a radiant skin that also stays healthy for your lifetime. We're going to apply a peel to the skin, which is the Essential Peptide Peel, a brilliant peel that is designed to be done on the day, so you don't have to prep for this peel. The other reason why it's really effective is the skin ingredients can be left on the skin for up to 12 hours. That means that the client can actually go home with the peel left on the skin and wash it off themselves at home. So the peel has been left on the face and now it's drying on the skin. And you can see that there's no visible irritation from the peel. It has a little bit of lactic in it, but it isn't overwhelming. It's just to allow the retinoid to actually penetrate the skin. And this essential peptide peel has a retinoid called LG-Retin-X, which is a delivery system. It's both retinol and retinal. The next level up of application is to actually combine the essential peptide peel with microneedling. So you can do microneedling at 0.25 or 0.5 all over the face, and then immediately afterwards apply the essential peptide peel, which makes it brilliant for people that have concerns like crow's feet or sunken eyes around that delicate area. And in your case, I would definitely be using a retinoid close to the eye to help prevent the sunken eyes, because I can see that you're just starting to get a little bit of fat loss. So you want to ensure that you keep the skin nice and thick and healthy to avoid looking premature aged. At the end of the treatment, you can apply some mineral makeup. I usually use Indica because the mineral has been micronized and it applies really smoothly over a peel treatment. So you just take the inside of the lid and you can tap that onto the skin, and then after tapping, you brush it into the skin. Using a kabuki brush or any kind of soft brush, it will not interfere with the effect of the peel. Mineral makeup was actually designed to use immediately post-treatment, which is what makes it brilliant. You can even use it following laser or any sort of skin resurfacing treatment like microneedling. The last step is to apply liquid crystals. These are the most gorgeous hydrating product to use on the lip, and it will also give a lovely glow to match your beautiful skin. You only need a small drop, and this product will last for several months. It's definitely my #1 go-to lip treatment for dry lips as well.